Let's. Okay. Helen, thank you for joining me today. How are you?
I'm very well, thank you. And thanks for inviting me.
You are quite welcome. I'm excited to talk to you. You were, your name came up in a previous podcast I had with someone else, and I just thought it'd be fascinating to talk to you, and it was. And so I'm excited to dive into it so all the listeners can hear. But first and foremost, who are you?
Well, my name is Helen Hall, and if you ask me a question on anything to do with movement, I would babble for hours. But as soon as somebody says, "Who are you?" and introduce yourself, I stumble over my words and wonder what on earth to say that would be even remotely interesting. I'm Helen Hall. I'm not an IST. I am unfettered by higher learning, in the words of the Russian mathematician who wrote the amazing book Stalking the Wild Pendulum, who never went to school and who solved the unsolvable Einstein theorem that Einstein couldn't solve. There was a theory and he couldn't prove it. And then this guy who never went to school, he thought he could, and he did. And so I just think, I don't know, I know who I am and I know what I do, but I'm not an IST. But I explore movement passionately. I dream it, breathe it, do it, live it, write about it, make courses about it. That's what I do.
All the things.
Yeah.
Well, cool. Well, let's get into the stuff that you can jumble about for hours. And that is movement. One thing that you shared with me when we talked before, which I loved the visual behind it, is the Lego story. So I would love for you to kind of start with that, and then we'll kind of just see where it goes from there.
Sure. So this was my attempt to make something that's unbelievably complex simple. And I was telling especially in clinics, so when I'm working with somebody, it needs to be at a practical level so that it becomes almost like shorthand or coding for, oh, okay, we're working with a piece of Lego here. So then it's easier to describe myself because it comes from the journey. So along the learning journey, post Royal Air Force, this is, I was the person who felt that they could help people with their movement. So I was an air traffic control officer at the time, but I felt compelled to be able to help the squadron football team. Now, I know nothing about football, but I just did help the footballers with their training or their movements or whatever it was. And then when I left the Air Force, this was back in the day, Jane Fonda was giving it large, everything was aerobics, and I didn't know my right from my left. I kept bumping into everybody in class because they would say, we're going to the right, and I would go the wrong way always. So in the end, I decided I would be the aerobics instructor, and then everybody could just follow me, and I would just say this way, and that cleared up any confusion. And after that bout of frantic movement, I went back to school, and I did a year in college, which was remedial massage. But when I came back from living in Africa and having my family, this was actually, people were being called sports therapists. So I was doing work that when I qualified, a sports therapy didn't even exist. So I was working with bodies and movement and pain and injury, and in Nairobi working with the physiotherapist clinic, and they didn't know, I was doing things I wasn't qualified to do, but in Nairobi it didn't really matter. And when I came back, started my lymphedema work, working with post-cancer patients, and so the learning journey continued. So in lymphedema work, with these gross swelling of limbs, you discover all sorts of different ways to enable that person not to cure the problem, because they can't, it's not curable, but to manage. And self-management came from organizing the alignment of the body. So that was the origin of the whole orientation towards not good posture, because that smacks of people putting books on their heads and etiquette and all of that very 1960s kind of stuff. Deportment. So not deportment, but just organizing the pipe work. So I would talk to the people I was working with and just say, well, we're just trying to stack everything so that all the pipes have as few kinks in them as possible. And it got results. I opened the first MBT shop in the country, and these were the enormous rocker-soled shoes from way back when that seemed very unlikely, but worked brilliantly because of the balancing effect. And then, of course, you've got all of your pipe works, all of your tubes all stacked vertically on top of each other, and things seem to flow better. And then this moved on to strength and conditioning and writing training programs and joint mechanics. So with all of this pooling of information and getting older and hopefully wiser and using it, so, you know, knowledge isn't power, but use knowledge is power. Then I started to realize that, you know, there were times when it would feel better in clinic. So for the client, it would, yeah, it feels better. And I would think, yeah, it looks better, but it wouldn't stick. For some reason, it wouldn't stick. And they would make some progress, but it didn't seem to be the kind of progress that we would really be expecting from that level of input. And by this time, I had bought advanced gait analysis technology so that I could see with my eyes what I was seeing and also be able to measure it. So I was measuring all this stuff and wondering why these protocols had effect, but not necessarily the bang for buck that I really wanted. And, you know, at some point you think, well, maybe it's me, maybe I'm rubbish at what I do. And then you realize, well, no, I don't think I am. So then what else am I missing? And my whole journey from leaving the Air Force to learning this and then learning that and going on these different courses was always because I couldn't answer a question. So what do I need to go and find out now in order to help, because I can't answer this question. So I couldn't help my best friend who had breast cancer, and as a result of her breast cancer she got lymphedema, and I had no idea how to help, so off I had to go to learn. So through all of the avenues of questioning, I can't answer that question, who can help me understand? I bumped into something called reflex integration, and I hesitate even to use the phrase, because when I work more with adults, and in my experience, if you mention reflexes, they think that they're doing some kind of baby stuff. So, but it was powerful. And so the story of Lego was born. That was a very long story, wasn't it? We get there eventually with me. So the story of Lego was born where I simplify the unbelievably complex. And for me, until we can build a robot that can move as a human, we don't know it all yet. We know some, but we don't know how much we don't know yet, in the vague words of Donald Rumsfeld, of course. And so I dived a little bit into embryology, which was way too complex. And, you know, we're not even born yet. So then it was the beginnings of movement. So how do we get to the joint mechanics that we have? How do we get to the skeletal frame and the muscular development that is possible? How do we keep breaking down barriers, and the Guinness Book of Records keeps having to be rewritten? How does this all happen? How do we recover from major trauma to the extent that we have to learn to walk all over again, when we didn't actually learn how to walk, we just developed the ability to walk? So this all became very fascinating, and to make a very long story and complicated story short, I made up this story of Lego. So here it is. Finally, we build. We build to the crescendo of. I hope it's not disappointing. So Lego. We're born as a bit of a blob. So we're, unlike many of the mammals that need to be able to get up on their feet and find mum, we're born and we have to be picked up by mum. So we're a bit of a blob. And so I imagine that we're a blob in the basement, and there are 30 odd pieces of Lego scattered around the basement, seemingly scattered, but actually strategically laid out along a DNA-driven timeline, so that we, as the blob, start playing with 1 or 2 pieces of Lego. Now, because we're a bit of a blob, we can't really do very much, and the first part of the Lego that we notice is the knobbly bits. So the knobbly bits refer to the reflex action, which is the level, the stereotypical response to a stimulus at the level of automaticity. So this is a reflex arc is a sensory stimulation. It could be a stroke of a certain area of skin, which is processed by the brain, actually in the spinal cord rather than the brain, because it's really quick, and then results in a motor response. So the stimulus is the knobbly bit, and the infant will play with the knobbly bit enough so that the knobbly bit, it loses its level of automaticity, and the infant is able to learn the shape, size, and color of said piece of Lego. So when they played with that particular piece of Lego, along with a few others, long enough, that piece of Lego gets to go in the box. It's now no longer a reflex action, it's a motor program or programs when connected to other pieces of Lego. And when there's a few pieces of Lego in the box, we can make a few more shapes and build some more stuff. And then we can maybe reach further out along the floor of the basement to start to find some more pieces of Lego. So the more play, so each piece of Lego creates a shape, it's movement. So each of these knobbly bits, each of these reflexes is a movement pattern. So all of this movement begets more movement and creates the strength and puts us in the position where eventually we are upright in the field of gravity instead of a blob. And we're able maybe even to reach up to the first floor. We're able to reach up to the stairs to the first floor. And in fact, the resulting event is by the time we're 7 or so, all 30 odd pieces of Lego are in the box, and the lid is there for us now to see that this is movement development, ergo infant development. But the problem is the label. I struggled with the label as, you know, who am I? What do I do? What are you? All of these labels, very tricky for me. So we've labeled it as infant development, but it's just movement development, because we get to do this our entire lives. We get to use this movement development our entire lives. It is not monopolized by the infant. They just happen to do it first. And which is really important, I feel, from even just the pure context of it's not just movement. It shapes our being, because these pieces of Lego are movement, but they are also our vestibular system, obviously, and our acuity. So it's our sense of the way we think, the way we feel, our personality, our characteristics. These are all developed from the Lego. So anyway, all things being equal, all the Lego is in the box come the age of 7, when our vestibular system is the first opportunity for it to be mature. And then that's halfway up the building. So instead of brainstem, we're talking basal ganglia. And then we can learn the skill. So we can now walk, skip, gallop, crawl, obviously, run, jump, wrestle, throw, climb, swing, and some degree of hand-eye coordination, foot-eye coordination. And then from there, the frontal cortex at the top of the penthouse suite gets to use whatever is in the middle of the building for learning skills of, I don't know, say dancing or gymnastics, or the finer art of grabbing a hockey stick and all of that skilled type of movement, which is based on what's happening in the brainstem, in the basement. So the Lego simply became a story of movement development, which then became shorthand. So if I was working with somebody and it wasn't any kind of strength or conditioning or joint mechanics, it was, oh, we're working with a piece of Lego. And it was like, yay, oh, this is easy. That if we're working with Lego, then expect great results, because we go from a blob to epic in just a few years. And an infant can do it, so how difficult can it be? And people seem to enjoy the Lego story, and it seems to sit better than other terms that are in use and more widely used, which is reflex integration, or some people use reflex inhibition, and all sorts of other terms which sound very much more medical and not necessarily very inspiring. So we build our Lego, organize our Lego, and great things happen.
So when talking about the Legos and movement development, like what happens, say, in our 20s and 30s when that little blob skips one of the Legos and it doesn't make it in the box?
Yeah, so and they don't know why that happens, and it does, and it happens with, it's a family trait. So people will say, oh, it's genetic. My entire family has bunions, or my whole family has the slouch, or several in the family walk like this. And so some of it is mimicry, and there's been lots of studies on mimicry, and of course we survive well by mimicking. And some of it are pieces of Lego that for some reason, and they don't know why, don't get played with enough for the level of automaticity to go. So the classic example that I see very often in clinic is the person didn't crawl, they just got up and walked early, and to great applause and huge pride. I was the same mum. I've apologized to my children so many times, and we're addressing the issue, and they have tickly feet. So the tickle is left in their feet, and since they didn't crawl, because if the tickle had been played with enough, they would have crawled. All things being equal, but there are quite a few pieces of Lego that are engaged in the act of crawling, obviously. But one of the classic signs is for an early walker, not the only one, but one of several, and a biggie, is they're an early walker and their feet are still tickly. When I asked them about it, they laugh and they said, yeah, don't go anywhere near my feet. There's mum and my sister, my brother is fine, but me and my mum and my sister, we all don't go near our feet. It's a whole family thing. And I say to them, well, the thinking is really that the tickle shouldn't still be there, because it's a leftover from movement development, which can come back because you can get a concussion later on in life, and some of your Lego gets shaken down in the basement a little bit too much, and the piece of Lego falls out of the box, hugely simplifying things, obviously. But things that were organized can become disorganized. So maybe they did crawl, but they've had a few concussions, and now they're walking funny, and there isn't the stability in their feet. And maybe it's not a tickle, but it's a residual. So when you stroke the receptive field, the tingle lasts too long. So if you stroke your arm, you know you've been there, I've just stroked my arm when I said that. I'm still aware of it, and in a few moments, it's gone. So if I really thought of it, no, it's gone. It's gone. So if it's still in your foot after a normal amount of time, this is it's a piece of Lego that needs organizing, because you're going through your foot in, when you're walking, 0.65, 0.8 of a second. And if there is a residual activity in your foot that lasts longer than the stroke on your arm, and we're not birds, we have to walk through our feet, then your central nervous system will find a way of suppressing it. Because you can't have it, we can't be upright humans in the field of gravity walking on our feet if every time we step on them, they are reacting with the ground instead of responding to the ground. And what we find is that people will walk on the outside edges of their feet, which is where one of the receptive fields is. They'll just kind of pin it down, because everybody knows if you've got a tickle, if you go in gently, it's a nightmare. But if you go in firm and hard, all is well. So you can kind of stomp your way into being able to use your feet reasonably well, as in not face plant. Or you can avoid that area altogether and just walk on the insides of your feet, and then you'll be labeled, not need or an overpronator. And you can do all the supination mechanics you want, but you are running away from the receptive field on the outside of your foot. So you'll make some gains, but it won't be able to hold, because your central nervous system wins hands down every time. Or your central nervous system will be okay about the receptive field pinging your big toe up, and so you'll just spend your life going through your socks and making big holes in the big toe. And sometimes the receptive field is so strong, people go through the uppers in their trainers, and even the uppers in leather shoes. I've seen this. So it's powerful stuff, and it leaves its mark. So it's understanding, it's just having the freedom of thinking to what it might be. It certainly might be you just don't have supination mechanics, so you just do supination mechanics. But if it doesn't really work, or if in the history they talked about familial things, or that they were very active as a child and an early walker, it's ringing alarm bells that, oh, hang on a minute, maybe they're stuck in this foot shape. And there's often a rigidity to the foot that you can even see if they're walking without their shoes on. So if you're assessing with shoes on, then you miss that juicy bit of information. Even if you assess with their socks on, you miss it. And there was a thought that just popped into my head that just disappeared again. I hope it comes back. Walking, assessing with and without shoes on. Oh, I hope it comes back. It's gone. Laces. They'll tie their laces really tight to pin their foot into the shoe so that there's no movement. They will call it all sorts of stories. We tell ourselves stories all the time. And I'm as guilty as everybody. The reason is so-and-so, so-and-so. And I read somewhere that you got to tie your laces really, really tight to keep your shoe on so that you don't get blisters, so you don't get rub. And the person who needs their shoe to hug around their foot so that that sensory receptive field doesn't get any input apart from you landing on it, those are the people that would be happy to tie their laces really tight. And you can see shoes that look tight on a foot, and you think, I wonder. And it's just a thought process for you to explore, rather than, this equals that. It doesn't work that way, but they're just clues to explore, because anybody else who didn't have something within the sole of the foot that they had to avoid, or their central nervous system had to avoid, probably wouldn't like their laces being tied quite so tight, and to be squished inside their shoes.
What's really fascinating about this is I like high school and college, I was that runner who put the holes in the top of their shoes. I realized like 2 years ago that I like standing on the outside of my feet. And I used to be really ticklish on my feet. And I've realized in the past, like since we talked last time, like I don't have that anymore. So, and I've spent a lot of time over the past several years, like working on foot strength and control and this, that, and the other. So I don't know if like you would know better than I would, like, is that kind of what helps get rid of it? Or is there something else I've done without realizing it that has gotten me past all that stuff?
So since we spoke, so you had ticklish feet and then we spoke and then you realized you were walking on the outsides of your feet.
I realized the outside of the feet thing about 2 years ago. It was just all of a sudden I realized more recently that I was like, you know what? I haven't noticed my ticklish feet for probably a few years. So it's just
So,
it just kind of triggered thoughts as far as when we were talking last time. Like I didn't really notice that for a while.
well, so have you tested your tickly feet?
Funny you asked, and the reasons came to mind. I was at my chiropractor last week, and he was looking at her. He was just assessing my feet, and he like went to tickle them, and he's like, "Nope, not ticklish." I was like, "Funny thing, I used to be." So he kind of did recently without me like thinking about it.
Okay. So it's then I have no idea. Maybe all of the foot strengthening work that you did had enough tactility involved in it that enabled the the receptive fields to just calm. And equally, I know plenty of people who've been through clinic who have rolled their plantar fasciitis on funny spiky balls endlessly, years and years of it, and their feet are still tickly. So I'm curious to know what may have triggered the loss of your tickliness, but it can be, you know, just enough. So I was working with a young lady who, it was an interesting case and quite complex, but you couldn't touch her waist. She moved in a way that restricted movement in the waist. And working on her, I had to work through really quite a few layers of thick blanket to the point where I had to just guess where her waist was. And so I knew that her brother had a weighted blanket. So, and all we did was, okay, every evening, just spend a few minutes lying on your side with the weighted blanket heavily pressing on your waist, side lying. And 6 weeks later, she was transformed. So sometimes there's just a small enough trigger is enough to remove, to quieten the receptor field, to organize a piece of Lego for it to go into the box and it not be an irritant, literally, anymore. So I would love to know what you did, because there are many ways to do it, and to learn another one would be very useful. So if you do remember, just drop me a line. I'll use it in my work. I'll credit you, obviously.
Awesome. I'll think about that and figure out what did I do. That might have been different. When we do have like missing Legos, or like we've gotten a head injury that's disrupted some of those Legos, what are we talking, like, does this cause injuries? Does this cause lack of performance? Like what sort of things are or can happen because of these missing reflexes?
Well, and it's not that they're missing, it's more they're not organized.
Okay.
So yeah, it's just everybody has them. They're in our DNA, and just some people just get stuck in them. I remember a guy came to me and he just gaily told me that he was born in Superman position. I said, really? Okay. And he would go to the chiropractor every week because his neck was always tortured. And the chiropractor every week would manipulate. And this was just the cycle that he was stuck in. And he was stuck in the Usain Bolt. I call it Usain Bolt because it's the fencing reflex. And he was still in it. His entire, he walked, his head was turned slightly left. he walked with his, oh, I'm zooming, aren't I? So his left arm was abducted, his left leg was abducted, his right arm walked as if he was carrying a handbag, and his right leg wanted to come in towards the midline. So can they cause injury? Well, yeah, pain, because you it's almost like you get stuck in a repetitive strain cycle, or it's a repetitive strain injury because you can only do the same thing over and over again. Your options are less when your body has that level of automaticity, which was really helpful in movement development, but is singularly unhelpful when we're meant to have 30 pieces of Lego in the box there to create any number of shapes. So, you know, our tongue is meant to be able to create 10,000 sounds. You think, how do they know that? That's a lot of shapes. But some scientist has gone to the trouble of discovering this or working it out. So it is, but if the tongue can only do one thing, then that cuts out this enormous swathe of other options. So this guy who only had left, he didn't have a right. So you promulgate that to the gifted footballer who so let's say he plays left back. So whatever type of football you're talking about, he's at the back of the pitch and he's on the left side of the pitch. Sorry, I'm getting my left and rights muddled. So he only has right. So he's at the left side of the pitch. Nobody can get to him on the left because he doesn't have a left. He only has a right. But he was all singing, all dancing, almighty on the right. He had a secret gift, a secret power, which was all he had to do was his eyeballs started turning to the right, his arm was out, his leg was out, nobody could get past, but they could blindside him on the left. But if the coach spotted it, he wouldn't necessarily know exactly why this guy needed to be on the left edge of the pitch. But when he was put there, he was epic until he sprains his right ankle. And he hasn't got a left. As far as the brain's concerned, he hasn't got a left. So then this right ankle sprain is a real problem because maybe that was his kicking foot. And unless this is noticed and addressed, you know, a sprained ankle that's not recovered could become something that needs surgery and can become something that is a career-threatening injury. So it depends on the context. But yeah, repetitively doing the same thing over and over again, we know is a repetitive strain injury, and that's the level of automaticity of Lego, or it can be, and it's a spectrum. It's always a spectrum. So the gold medalist fencer, who has a sneaky little gift that nobody else knows about, he's there on guard. All he has to do, he has reflexive speed. Now, reflexive speed is, what is it, 80 to 120 meters per second, as opposed to conscious thought, which is not as fast. So there's a secret unfair advantage until it actually gets in the way of life. and then actually you really want to organize it, because it does get irritating. So the person who's the fidget, who can't sit still, they can't lean back on a chair because it just drives the receptive field on their back mad. But all that wiggling has hiked a hip and might have dropped a shoulder. And maybe somebody said they have a scoliosis and they're trying to fix the scoliosis, but it's just a tickle. And the more you know about it, the more exciting it becomes, because the possibilities are now with just limitless.
Yeah, like this is just also, it's so fascinating, especially like with my background as far as knowing, you know it a lot better than I do, but I mean, I remember taking movement development from infancy when I was in PT school, and I'm not a pediatric therapist, so I forgot it all for the most part. But I remember learning it, and it's just so fascinating how not hitting those reflexes and those patterns or those milestones, or we all know that child who went straight from like kneeling to standing up and walking, avoided crawling, and we don't think anything of it when they're that age. But it's so fascinating how those little things of like progressing too fast can cause so many issues.
Yeah, so many of the adults that see me, they mention, you can see the things bubble coming out of their head. I know that they're not with me. They are already promulgating the information that they're receiving onto their family. And I said, you recognize one of your children in you, don't you? And I said, just get them to do your homework. They don't need to come, they don't need to see anybody. It's probably familial if you have the same symptoms, of course, symptoms with in little inverted commas. It's not so much symptoms, it's behavior patterns and movement patterns. And I said, just do the same homework. It'll work for everybody because it does work for everybody. That's the point. It is universal. And in the words of the Muscadova Neurosensory Motor Reflex Integration Institute, it is the innate intelligence of the body. You tap into that, and then the world of joint mechanics comes to life, and the possibilities for further, faster, greater, bigger. It's there. Huge potential.
So how do we go? You mentioned homework, which obviously is super important to overcome all this stuff. How, and I know it's a very complex answer, but as a general, how do we go about reorganizing everything properly? Because I know it's not just strengthening exercises or doing, all that stuff. So what does that look like as far as someone working to reintegrate all these reflexes properly?
Yeah, and this is it's a really good question, and there are bodies, as in fields, practitioner bodies of work, who use there's something called the rhythmical movement method or rhythmical movement therapy, where it's basically rocking movements, and for children. This is probably quite easy. For adults, the concept of it. So I'm trained in Paul Chek's work, so a Czech practitioner, and he is unafraid by any labels of infant development, and we are actively taught thumb sucking and crawling using our forehead, the inchworm, and just basically wiggling around on the floor. It's unbelievably hard work, and you realize how unbelievably strong babies actually are. And there are certain populations that would be okay with that. In my experience, not only do people get a little bit angsty or not sure if they're in the right room if reflexes are mentioned, certainly if I mention sucking a thumb on the first session, they wouldn't come back. And it's not necessary. So I'm working with somebody at the moment who has voice strain, and his sucking reflexes are all they're not active enough, and one part of the base of his mouth on one side is much tighter than the other. And we're working with the sucking reflexes, but you don't have to suck to do that. All you have to do is understand where the muscles attach to, what the tendons are doing, and work the tendons, because the Golgi cells in the tendons will talk to the muscles for you. So you don't actually have to go through the action of sucking. You don't have to go through the action of crawling. You don't have to become the baby to organize movement development now that you're an adult, because I think that people, they're curious because they've got tickly feet but they don't want to have to go around crawling on all fours, because some adults can't, because it hurts their knees. Some adults can't because they never did in the first place, and that's the point. They didn't in the first place, and they still can't because they couldn't in the first place. The baby, them as a baby, didn't choose not to walk. They didn't have the raw material available. That piece of Lego was too far away. They couldn't play with it. So, but we're driven by curiosity. So they crawled their way up the furniture, crawled. I didn't mean to use that word. It's brachial movement, isn't it? So they use the furniture to bring themselves to upright, or a very proud parent's finger to get to upright and onto their feet quickly. So crawling in an adult way isn't going to form the movement that was missing in the first place that prevented them crawling back then, if that makes any sense. Mm-hmm. So I work very mindfully that it is far better to use the understanding of the movement pattern to then come up with ways to incorporate it into movement for an adult, and for an adult to feel as if it's acceptable. And to not make them feel as if they're regressing into infancy, because it's not necessary. Mm-hmm. Some people will happily wiggle around on the floor, and it's great, because if you missed all that tummy time, go enjoy. It may be that just through play, you organize that which is disorganized, much like maybe you organize within your feet that which was disorganized simply through enough play with your feet, because that's how a baby does it. They play, they don't go through protocols, they don't do X amount of tractions of this, that, and the other. They play, this foot wafts in front of their head, they grab it by freak, they stick it in their mouths because that's how they explore stuff, and they connect that feels quite good. They get feedback from it because there's so many sensory nerve endings in feet, and then they realize that they can do this at will. So the feet get played with. And then, of course, mum and dad come along. This little piggy went to market. This little piggy went home and play with toes. All of this play happens if the feet are out, not hidden away in baby grows, and not put into pretty socks and pretty shoes that look like pseudo grown-up stuff. So long as that doesn't happen too soon, the feet will get played with. And so sometimes play is all you need. The vestibular system, maybe just, being on a swing is all you need to help stimulate the brain to figure out what is happening in that swinging action, for it to do that last little bit of organizing the knobbly bits of the Lego, to take it out of the automaticity level of I'm unstable on my feet because I can't cope with any forward and backward movement very well. But you sit on a swing for long enough and your brain will figure it out. Maybe, and quite possibly, because that's how it all happens in the first place. So I think that ways to help people really are limited only by your imagination once you've been given the protocols and you understand what the reflex arc was doing in terms of a motor response in the first place. But just as an example, and because I can measure it, and I have data, so much data of applying a protocol and getting a response, some response, but it not sticking. And then doing something as simple as feet wiping. So giving essentially a shed load of just barraging the central nervous system with information from the soles of the feet, because maybe it just didn't have enough and they've been wrapped up in socks and shoes ever since. And it tends to be these people, they don't want, they never walk without their socks on. Oh no, they always put my slippers on. And it's Princess and the Pea. It's not, there's a saying about, it's not the mountain that breaks you, it's the grain of sand in your shoe. And you think, maybe your feet are too tickly. because we should be able to cope with a grain of sand in our shoe, right? So these people will, oh, no, I can't. I have sensory mats here with all sorts of spiky, knobbly bits. And they're, ooh, 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 ooh. And then I think, yeah, your feet, they need more information because they're hypersensitive. And you just give them a shed load of information. So you wipe your feet as if you had shoes on and you had stuff on the sole of your feet. And some people really don't like it. It's like, oh, no, it's hard. Oh, it's really horrible. But gradually it calms. And, a few weeks later, they're laughing about it because now their feet have freedom. Their feet can relax. Their feet can load. Their feet can lengthen in pronation and recoil and give them supination. Who knew? And it was just that they were hypersensitive. And it works the same if you're hyposensitive. So there are people who can just take their shoes off and stomp around on coastal trails. I'm working with a guy now. I'm going to run the coastal trail, stony paths, proper barefoot. And I thought, how on earth are you managing to do that? Your feet have there are only 3 places in the body, as far as I recall, that have all 9 types of skin receptors. The palm of your hand, or your hands, the palm side of your hand, all the way through to the fingertips, your tongue, and the soles of your feet. So they're there to give you a lot of information. So how can you go from running around with your shoes on to taking your shoes off and not batting an eyelid, running along stony coastal trails in the UK? It's just, that's madness. And I was working with him and I said, just as soon as you touch my finger with the ball of your foot, just stop. And then, I was going red in the face and I said, okay, stop, you're breaking my finger. And he couldn't feel it. He couldn't feel that he was pressing down on my finger to the point where I was nearly going to scream. And then it all became clear. He was hyposensitive. And so we did the same thing, because it's not about switching things on, switching things off, activating, deactivating. How do we know what's going on? This is all happening too fast. It's about regulation. It's about organizing. We don't want too much. We don't want too little. We just want just right. Well, we can't find it, but our central nervous system can. Just give it the information for it to utilize. So he did exactly the same as everybody else, wiped his feet thoroughly, a lot. And now he's messaged me and he said, oh, my plans to run around the UK barefoot, I think I need to amend them. And I thought, oh, can you feel stuff now? And of course he could feel stuff now, which is what the feet are meant to do. They're meant to feel stuff. So it's not a party trick. They're with us for life, and they take us on all sorts of adventures, and we need them to give us the information that they should be gifting us.
This is also interesting, and I think I could talk for hours with you, but I value your time and our listeners' time, so I won't do that. If someone does have more questions for you or just more curious about what we've talked about, where can they find you?
I'm always in clinic. So I have a website, helen-hall.co.uk, and I'm on Insta, and I can never quite remember what my Insta thingy is. Helen Hall PFM, but I might be wrong. It might be that.
You can find and put it in the notes.
Yeah, and I'm writing a course to try and condense. I listened to Dr. Chatterjee's podcast with Jake Humphreys, who has his own podcast working with high performance, like, people like the world motorsports leaders of enormous corporations. And they go on his podcast and share their stories and silky skills to see if it will help others. And he said the common denominator with all these highly successful people was they just shared stuff. it's not to withhold and say, well, you got to learn it yourself, because we learn by mistakes. If we keep having to reinvent the wheel, we're never going to get anywhere, are we? So I'm quite old now, and I've accumulated quite a lot of understanding. And with Doris here, proving or giving me data, no, that's not worked. It looks like it might have worked. The person feels better, but actually the data is going in the wrong direction. So no, that's not your homework. We need to revisit and reassess. So with all of that and better understanding, I'm just developing courses so that people don't have to start at the beginning again. They can add it to their toolbox and then build from there to bigger and better and even more.
Awesome. And I'm excited for that to come out, because I'm excited to see what it's all about and potentially dive into it. It sounds, everything you talk about is so fascinating. And I just thank you for your time today.
My pleasure. Thank you for listening to me babble on.
Of course.